Hello everybody, my name is Dr. Shadi Arafat. I'm a board-certified veterinary surgeon. This video is part 3 of our intervertebral disc disease series. I hope these videos will add to your current understanding of this condition in dogs and allow you to make an informed decision regarding your pet's care. Always follow the recommendations of your veterinarian or veterinary specialist closely. Today we're going to focus on intervertebral disc disease medical management in dogs. Now, just as a reminder, we're going to be focusing on the spine of your dog, and check out our previous videos on intervertebral disc disease as well, talking about the different types of disc disease involved with pets. There are several reasons why your pet may undergo medical management for intervertebral disc disease or disc herniation or disc protrusion. The first reason is that your pet was deemed to not be a surgical candidate. These cases are based on the signs your pet is showing and on imaging used to diagnose the disease. This will be basically a decision of your own choosing in combination with your veterinarian or veterinary specialist recommendations. The second reason why your pet may undergo medical management is because you've elected to not undergo any type of surgery for fear of the risks involved, or because the prognosis may not be that great in your pet's case. In this scenario, your pet's quality of life is taken into consideration, understanding that if surgery is the recommended treatment of choice at this time and you decide not to pursue it, that the prognosis may be worse long term. And the third reason for medical management is used as an adjunct for a patient that has already received surgery. So regardless of the scenario, medical management for dogs with this disease are similar, even if your pet already had surgery for this disease. Now, to go into more details regarding what medications are used, we'll start off with anti-inflammatories. Anti-inflammatories are the main treatment of choice in dogs with this disease, in my opinion. Anti-inflammatories include those that either are steroids or those that are non-steroidal. There is still no clear-cut benefit as to which of these two options may work better in dogs for these conditions. So please follow the recommendations of your veterinarian or veterinary specialist. I prefer the use of steroids myself. Anti-inflammatories not only decrease the inflammation of the spinal cord, but also provide analgesia as well. Recent blood work is recommended if anti-inflammatories are going to be used. Our second type of medications that can be used are analgesics. Such medications include opioids or narcotics, the most common one being tramadol. Another type of drug class that can be used are those that are specific for neuropathic pain. A classic example is gabapentin or Neurontin. These are analgesics that are used in many different cases, especially if pets are not allowed to have anti-inflammatories. The exact drug of choice is going to be based on your veterinarian's opinion, and they can be combined as well depending on the case. So please make sure you follow your veterinarian's recommendations or veterinary specialists as to which drug or which combination of drugs they prefer for your pet. Finally, supplementation. Lifelong supplementation with joint supplements are also recommended. These include glucosamine chondroitin as well as fish oil supplements. They have been shown that over time that they can have some anti-inflammatory properties. They maintain the health of all the joints in the body and the discs in your pet's body, and all of your pets can receive these supplements. Side effects with these types of supplements are also rare to uncommon. And then going beyond the medical management route, we're looking at weight management. And so, just like in people, if you can maintain a lean body mass, there'll be less pressure on the joints, less pressure on the discs, and hopefully will help with healing. So to prevent new disc herniation, prevent recurrent disc herniation, or any other types of joint disease, I recommend using lifelong supplementation. Make sure that if you're going to follow a weight loss program, that you follow whatever your veterinarian recommends or nutritional specialist recommends for a strict dietary plan. Tying into this is activity modification. So if we can focus on minimizing trauma to your pet, prevent disc herniations or other trauma in the future, that also will be quite beneficial. Whether disc herniation is suspected, has been diagnosed on imaging, or whether surgery is performed, strict rest for a minimum of 6 to 10 weeks is usually recommended to allow scar tissue to form and allow adequate healing to occur. Every pet is different with how quickly or how slowly they form scar tissue in order to heal an injured site. And last but not least, modalities that have gained tremendous popularity over the past several years include acupuncture, physical therapy, and laser therapy. These treatments are exceptional and have no side effects. They can be combined with surgery and the medications we just discussed. Certain centers may offer this type of treatment modalities, or they may recommend that you either follow up with a center that specializes in these types of therapies, or even YouTube videos online can help you as well perform physical therapy in your pet. Just make sure that you first ensure that your veterinarian or specialist is okay with these different modalities in your particular case. The duration of medical management is wholly dependent on your specific case and can range from several weeks to lifelong. Again, make sure you follow the recommendations of your veterinarian or veterinary specialist devising a long-term plan for your pet. Now, please check out my next video discussing intervertebral disc disease aftercare from surgery. Thank you so much for your time. I hope these videos will add to your current understanding of the condition in dogs and allow you to make an informed decision regarding your pet's care. Always follow the recommendations of your veterinarian or veterinary specialist closely. Please show your support by subscribing, hitting that like button, and sharing this video with others. This is Dr. Shadi Rafij, and I thank you again for watching. Let's take care of our pets.